Well, I'm here at SIOG and learning about the new development and new studies in geriatric oncology. And I wanted to highlight the recent participation in the Academic Association of Community Cancer Centers that developed a group of geriatric oncologists and had basically an advisory committee looking at how geriatric oncology is evaluated, how older patients are treated within community cancer centers in the United States. Part of this committee ran a very large survey that was implemented in many community centers across the US and identified various gaps in knowledge, gaps in care, barriers to the care of older adults, and barriers to the use of validated geriatric assessment tools within community oncology practices. So that was very eye-opening and led to a huge educational effort through the ACCC, developing webinars that are actually still free and available online for community oncologists to listen to and learn more about geriatric oncology and how to improve the care of older patients. So the survey showed, number one, that this is a huge issue or problem that affects all oncologists and mainly in the community where most of the older patients are being cared for. It also identified many barriers to including geriatric assessment and specific evaluation of older adults, mainly time and personnel barriers of just people helping conducting these assessments. In addition, we noticed that there's a huge variety in the type of tools that are being used with very little education provided to the oncologist on what would be the best available and the best predictive tool to use in these situations. And I think that led to really developing this educational symposium or webinars that address both the general approach to older adults as well as geriatric assessment, specific tools that can be used, specific issues like polypharmacy that's highlighted within this assessment, and the use of palliative care and supportive care in the older population. Well, I think number one is acknowledging the issue and acknowledging that treating older patients carries different challenges and requires different approach is the first step. So once that's acknowledged and there is buy-in from physicians, staff, the next step is educating ourselves and understanding what can we do to improve this care, what tools are available, and how we can really address the needs of this special patient population. So I'm very excited that these tools are available. I know that ACCC is continuing the efforts of promoting this educational series and trying to really get this to all of the community oncologists that are out there. And hopefully these efforts will continue to address other areas within geriatric oncology and really hone into the needs of these patients. So this was a really exciting thing to participate in. It really was a group of oncologists and geriatric oncologists and geriatricians that came together to think about how do we improve the care of older adults in the community. There's a lot of work that's being done in academic centers, but as I said earlier, that's not where most patients are being seen and treated. So we really want to reach the area where the patients are actually seen and make a difference there. And that was the most exciting part about participating in this advisory board. Thinking about how can we take these tools that have been researched, have been validated, and apply them at the level where maybe there aren't that many resources, but with simple tools we can improve the patient's care. And that was really rewarding. I just want to encourage everyone to look into these webinars. They're easy to access, they're free, and I think you can learn a lot and maybe even apply some things to your practices. So the ACCC website has a link to them, and as I said, they're all free and available at any time.